Previously, an estimate of 1.4 million people in Uganda were living with mental health conditions. However, in the latest report, according to UBOS, the number has now skyrocketed to 5.5 million Ugandans battling with mental health issues.
The recent housing census tells us that at least 12% of the people counted had what we call a probable mental health challenge. And 12% comes to about 5.5 million people. If you realize this number is even bigger than the number of people with HIV normally quoted.
Health officials attribute this surge to a complex mix of factors. According to Dr. Daniel Chabayinze from the Ministry of Health, mental health problems are now most common among the youth, driven by financial instability, unemployment, and the widespread use of cheap illicit drugs.
By the National Mental Health Institute in Butabika Hospital has shown the number is almost 3 times more than what we thought. But we have also to understand that mental illness is caused by many things. One of the main factors currently in the youths and young adults is taking of alcohol. Alcohol use in so many different places, even young age groups who are beginning to use alcohol and drugs, illicit drugs and smoking. These coupled with a lot of financial stress, increasing their anxieties, their depressions, their failure to cope with the life stresses.
Dr. Chabayinze further blames poor parenting and the unregulated sale of illegal alcohol, often promoted by communities in desperate bid to earn a living.
We understand that children are raised from families. Families become young adults, and these young adults must have picked something from their home where they grew. So it all boils back to parenting, first of all, and having role models. If the adults are not behaving right for the children to model, then when they grow, they take up this. And then there's a lot of selling of illegal alcohol everywhere. So there are two things: family fabric at home, in the community, but also where people are using alcohol as a source of revenue, livelihood.
In response, the Ministry of Health, together with COP, Pentecostal and Evangelical missions, partnered to extend mental health support to underserved communities.
We, as an organization, have partnered with the Ministry of Health concerning the mental health area, and we are glad to tell you, our guest of honor, that we are ready to launch our faith-based program.
Is a system, is a group, is an umbrella organization which is bringing people together to address a community challenge. Mental health is a challenge in every family. Every family in Uganda is affected. They have somebody who is going through either depression, mental derailment, schizophrenia, attention deficits, drug abuse. So all these are part of dementia, and we now also have old people. All these need mental support. So government alone, which cannot reach our communities everywhere, needs support with such umbrella organization like COP.
COP is now organizing faith-based counseling groups, especially in hard-to-reach areas where government mental health services are limited.
We believe that we are ready for the running year. This year we have used the principle of elasticity. We have skinned down, and we have done a small event because of the days we are in, and we do not like to antagonize with so many things which are going on. We believe that after today, we are living here fired up and ready to encounter the challenges and giants who are out there. COP will bring a difference in Uganda.
According to Pastor Michael Chaze, the overseer of COP, even church ministers themselves are battling with mental health challenges resulting from dealing with people's spiritual burdens while struggling with their own financial challenges.
The issue we are fronting this time is healing of the healer. That is when you go to church expecting to be healed, and you find a pastor who's ill mentally because he's distressed, lack of finances, having groups which are fighting each other within the choir, within the prayer groups. He's always resolving conflicts. He has got domestic conflicts. He doesn't want to go back home. He has got church conflicts. He's preaching every day, shouting every day, Monday through Sunday. And so we have stressed pastors and stressed ministers in church.
He says COP has already created small faith-based support groups, particularly targeting the elderly, aged 50 and above, many of whom were neglected.
No, Rachel, tuina faith-based small group omuli abantu 50 abasuka emyaka 5 nga bamiitinga ne bafuna counseling, fellowship ne refreshment. Tulina abaweereza betwogera nabo one on one abazze gye tuli nga basaba okuyambibwa obulamu bwabwe nga buli mu stress. Nsaba nabo era tukkiriza nabo okusumululwa n'okujjanjabwa. So omulimu gugenda mu maaso.
As the mental health burden grows heavier, the government is now calling for wider sensitization, stricter laws, and higher taxes on alcohol to reduce its accessibility and impact.
That they're giving themselves to selling things which do not, even when they are taxed, the money does not come back to rehabilitate the people. It is spent on other things, infrastructure, roads, but we knew that they put the tax so that they can help people to reduce the amount of alcohol consumed, so it should also be used in public health promotion.
As Uganda confronts this growing mental health crisis, it's clear that the response must be both multi-sectoral and inclusive. Naguja Serena, Namsoke Naume for NSTV.
As you prepare and end the second year, be resolved. You are going to tell whoever stands in your way, our God will deliver us.